As friends and relatives prepare for the burial of the former Speaker of Parliament, Jacob Oulanyah, it is now clear that he succumbed to multiple organ failure as a result of advanced lymphoma. While his body lay in Parliament on Tuesday, some legislators questioned the country's ability to treat cancer. Today, the Director of Research and Training at the Uganda Cancer Institute, Dr. Nixon Niyonzima, has made it clear that they only have the capacity to provide care for 250 patients a day. This is out of at least 500 outpatients who visit daily.
Our patient numbers have doubled since 2015. Between 2015 and now, we have seen more than, in 2015 we have seen 3,000 new cancer patients every year, and like I've said, in 2021 we saw 7,400. So the numbers have doubled, but of course, interestingly, the budget has not doubled. The budget has increased, but has not doubled to meet the demand, the increasing demand for cancer care.
Health Minister Dr. Jane Acheng told Parliament on Tuesday that Uganda does not have a PET machine which would have helped in providing care for Oulanyah.
PET is a more accurate way of imaging. So for cancers, really you have, currently we use CT scan and MRI, but these help you in staging, not diagnosis, but staging of cancer. And staging is really where you determine how far the cancer has gone. And if it's coming back, you're able to detect it very early. So what PET does, it shows you actually to the minutest detail where cancer is in the body. And it's more accurate than CT scan, more accurate than MRI. And that's why most Ugandans go out after receiving cancer treatment here. They go to India, to Dubai, and now to Kenya to do a PET scan and see if there's any evidence of cancer. If there's evidence which you're not able to detect on CT scan and MRI, then you can intervene when the cancer is still very small to improve the chances of survival.
In addition, the institute received 251 billion shillings to equip the 4 other bunkers.
As of today, we have 3 radiotherapy machines, including a state-of-the-art linear accelerator. And before the end of this financial year, we expect to receive 4 more machines, including 2 new linear accelerators, in addition to the one we have, and 2 high-dose rate brachytherapy machines. Additionally, we have received financing from the government of Uganda to set up a nuclear PET imaging facility. People are familiar with PET, but we have received financing for this. The contract has been signed, and we hope to begin making sure that this is functionalized before the end of this financial year.
However, the institute remains underfunded, operating on a 42 billion shillings budget. Of this, drugs and consumables take 10.6 billion, 10 billion is earmarked for re-equipping the facility, and 7 billion shillings for wages. He says that for it to provide the desired service, government should provide 60 billion shillings for drugs alone.
We hope in about 5 years, actually in about 3 years, we'll be able to have the complete unit set up such that Ugandans never need to go abroad. And also, this nuclear medicine facility is not just for imaging, but we're also able to actually produce some diagnostic or therapeutic tools for some cancers. For example, there are some patients who need radioactive iodine that we have been importing from South Africa for the few patients with thyroid cancer. And with this facility, we'll be able to actually produce radioactive iodine here and treat those patients here.
Uganda's cancer burden continues to grow, with cervical cancer, prostate cancer, breast cancer and Kaposi sarcoma among the commonest types here. Walter Mwesigye, NTV.